living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
When you think about getting healthcare at home, does it take you back to years gone by when doctors showed up at a person's front door with their medical bag in hand to make a house call? Well, those days are not necessarily behind us. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Lisa Sather, your host. Today we explore home healthcare, what you need to know about home health services, and how to get them. Stay tuned. Welcome back. Today we're aiming to help you understand different types of healthcare that you can receive in your own home. Joining us first this morning is Roxanne Closey, Assistant Vice President for Clinical Services at Easter Seals Goodwill, Northern Rocky Mountain. Thanks for being here, Roxanne.
Thanks so much for having me.
So, thank you. In 2019, we really don't see doctors making house calls anymore, and so I think it's important that some people might not even know that they can get health care in their own home. Do you think that's an important aspect of what we can do in this day and age?
Well, something that we're trying to do is keep people out of the hospital. We know that it costs more money in order to have somebody in a hospital setting, even in long-term care or an assisted living facility. So what we do and what we're able to do at Easter Seals Goodwill is offer home health care services in the home, and that's basically a skilled nurse who will go to the home, especially for someone who has a really difficult time leaving their home easily. It's a big task for them to have to leave to go and see a therapist or to go and see a nurse. So what we do is we take our nurse and our therapist to them, and we go into their home and we offer the same type of care they would receive if they were in the hospital, obviously not in the same environment. So we do recognize that we are being invited into their home, their sanctuary, and we are privileged to be able to go in and care for them.
That's wonderful. So I understand there are different levels of care that a person can receive in their home, and I assume that can be confusing to people. How do they understand what that's all about?
So with anything, there are different levels of care that we can provide. At Easter Seals Goodwill, we have multiple levels of care that we can provide in the home. So if you have an individual who basically just needs someone to help them with grocery shopping, maybe preparing meals, maybe changing some bedding or light housekeeping, preparing those meals and putting them in the freezer so it's easier for someone to take out. We have personal care services, and those individuals that go into the home are personal care attendants. They receive 16 hours of training, and then they can go in and take appropriate care, whatever that level of care that individual might need. So we look at that, and then we would graduate to maybe a private duty nursing, and that then is primarily an LPN who would go in and they would set up medicines for that individual for maybe a week or 2 weeks. They might do nail care, foot care, if they need to have some help with that. If they just need their blood pressure checked, they would go in and take their blood pressure. So those are some of the basic things that we can do with our PDN or private duty nursing model. Then we would graduate to the skilled, and that's someone who has that difficulty in getting out of the home. And so we bring our nurses in to help them with wound care. Maybe they have a catheter in place and they need some help with that. Maybe they've just had surgery and they just are not very strong, and so they need to build their strength again. But they want to stay at home. They don't want to go somewhere else. And then we take it to the next level, and that would be our hospice care. And that's basically helping individuals, once they've reached the end or towards the end of life, be able to stay at home and die with dignity. So we have that complete umbrella of services we can offer.
With so many different levels of care that are available, and considering that you provide services in Montana, Utah, Idaho, and Wyoming, how do you decide which services to offer in which community?
So at this point, our clinical services, all of these services that we've been talking about, are only offered in Montana.
Okay.
So when we talk about Easter Seals Goodwill Northern Rocky Mountain, we do span the 4 states, but we have different types of programs. So we have anything from children's therapy to autism support, behavioral health, And then we have workforce development. We're a really big organization, and we have lots of other things we can talk about maybe on future shows.
Sounds good. Are there programs like yours available in other places? Are they available everywhere?
They are available. So you would want to look in your own community and see what you have in your backyard. And part of the challenge can be just being able to identify that level of care. And I know that if you wanted to call us, we would be able to help assist you with identifying the type of care that you would need or would best suit you. And if you are not in one of the communities that we serve, then you would be able to pick up the phone, and I know somebody would be willing to help.
Excellent. So we've heard of something like a grandchild potentially getting payment to be their grandparent's caregiver. Mm-hmm. Is this really possible?
It is. So with our personal care services, again, just kind of think of personal care as companion care. Mm-hmm. So that's the meal prep, shopping, bathing, light housekeeping, that kind of thing. So a big challenge in the state of Montana is we are so rural. It's difficult sometimes to find someone who would be willing to take care of someone who needs the help. Mm-hmm. But if they can identify a friend, a family member, then they can potentially be employed by Easter Seals Goodwill as a personal care attendant, and then they would be able to participate in what's called a self-directed model of care. That is that individual who needs the services is identifying who they want to take care of them, and then we go through that process.
Awesome. So we have about a minute left in this segment. Can you talk about how home health is different from personal care? Is it different?
It is different. So I like to think of personal care as more a companion care. So that's that support in the house, being able to help with bathing and that kind of stuff. When you're looking at home health care, that's skilled. You need a nurse, you need a therapist, you need that higher level of care. So they are very different.
Excellent. Well, we're going to pause for a break, so thank you, and I'm assuming you'll stay with us for a little bit longer.
I'd love to.
Wonderful. Coming up next, we're going to talk about different types of care you can get in your own home and who pays for that care. Don't go away. We'll be right back.